Just last week, Governor Patterson dedicated his entire State of the State address to the rebuilding of the economic infrastructure of our state. But underfunding reproductive health care at the state level will most certainly impede the efforts of these economic advances. It's not enough for private health insurance to cover comprehensive reproductive health care to those who haven't. Secretary Clinton also iterated in her speech that as a society we're morally obligated to ensure that women in our communities have access to reproductive health care, not just those women of means. Underfunding family planning would reestablish a discriminatory health system that New York has been striving for decades to reconcile. We're also fighting the battle in Washington on the federal front with health care reform. Women should not have to make decisions about their comprehensive health care that jeopardizes their lives or their future based on economic circumstances. That's just what will happen if anti-choice forces win in Washington and family planning is not fully funded in the state of New York. New York State and the nation are well known for enabling women and their doctors to make the decisions that are best for them. If we start providing comprehensive reproductive health care, if we start providing comprehensive health care and underfunding New York State reproductive health care, then we will be undermining 40 years of public policy that our state and nation have stood by. Beyond the funding, we're also watching privacy rights attacked on a national level. That makes it all the more imperative that the Reproductive Health Act get passed in the state of New York. We need RHA so that reproductive health care that women, families, and providers are used to giving and receiving is maintained. We need to maintain policy through RHA and funding. One without the other doesn't keep the doors open and doesn't keep reproductive health care and justice alive and strong in the state of New York. We are tough in New York. We have weathered many, many storms. And we're here to weather another one. And I'm going to ask you to ask those lawmakers to stand with us shoulder to shoulder and keep our doors open during this storm. I'm going to leave you with this. There are family planning health center CEOs sitting in this audience today. And they're going to be making very serious decisions every single week of every single month of this year. And those decisions are going to impact the potential limits on patient services, treatment hours, hours of operation, healthcare accessibility in their communities, just as they've been doing for the last few years. But every month and every week this year, those decisions are going to have greater consequences. I assure you that once health centers close, getting them reopened is a very expensive proposition that we will not be able to foster.